Greetings. My name is Cynthia Chaudhary, and I am the Senior Program Manager on the Health Systems Transformation Team at the Association of Maternal and Child Health Programs. Today, I'm going to provide a very brief overview of the Title V and Medicaid Interagency Agreement. Essentially, the Interagency Agreement is between two titles of the Social Security Act. Title V, which is the Maternal and Child Health Block Grant, and Title 19, which is the Medicaid program. Through several historical pieces of legislation, both Title V and Medicaid have mandated requirements to cooperate and enter into an agreement. The Omnibus Budget Reconciliation Act of 1989 requires Title V agencies to participate in developing and carrying out agreements on coordination of care and services with Medicaid, coordinate activities with the EPSCT program, assist in identifying and registering pregnant women and infants who are eligible for medical assistance, and provide a toll-free telephone number to help parents obtain information about services under Title V and Medicaid. And all of these requirements are in relation to Medicaid. My next several slides will focus on federal legislation and regulations that pertain to Medicaid specifically, and how Medicaid is supposed to work with Title V. The next few slides will focus on the Code of Federal Regulations for Medicaid. While Medicaid does cover a very large population beyond maternal and child health, Title 42, Chapter 4, Part 431, Section 615, Subsection B, essentially lays out the populations that Title V grantees may receive federal payments from Medicaid for, and that includes maternal and child health services, children with special health care needs, maternal and infant care projects, children and youth projects, and projects for the dental health of children. In the same Code of Federal Regulations, Subsection C lays out requirements for a cooperative arrangement, essentially laying the foundation for an agreement. And then subsection D lays out some key areas that interagency agreements should specify as appropriate, including services provided, methods for identification, referrals and reimbursement, and of course, mutual objectives between the two agencies, Title V and Medicaid. Now we'll switch to highlight a few Medicaid regulations from the Centers for Medicare and Medicaid Services, CMS manual relating to the interagency agreement. As you can see, the CMS manual requires that each state have in effect an interagency agreement that provides for care and services available under MCH programs and utilizes MCH grantees to develop more effective uses of Medicaid resources. The CMS manual also lays out notes on payment arrangements and responsibilities. For example, stresses the importance of including a detailed description of payment arrangements in the interagency agreement. I provided a very high-level snapshot of the different legislation regulations, and this website here provides a more detailed overview of the regulations as they pertain to Title V and the regulations as they pertain to Medicaid. However, as you'll note, most of the requirements for cooperation are within the Medicaid program. There are several components one can include in their interagency agreement. Some are required through regulations and mandates, and some are suggested. These are a list of components that I have pulled from a few partner organizations. Title V coordination with Medicaid for identification and outreach for those potentially eligible. Title V as a complementary agency for early identification of all MCH populations who are potentially eligible for state Medicaid. And when Title V is a Medicaid provider, the interagency agreement should clarify reimbursement arrangements. The interagency agreement should also include arrangements for ensuring all eligible children receive early periodic screening and treatment, reporting and data sharing arrangements, and the agreement should be written as a contract between the two agencies and defines a cooperative relationship. While many interagency agreements are quite old, there has been a recent focus on these interagency agreements again, and there is an opportunity to revisit the agreements and use that as an opportunity to get to the table with Medicaid. I know my colleague Paige will talk a little bit about how the interagency agreement can be used to leverage or advance health equity. This was a very brief overview, and this is my contact information if you have any questions or would like to further connect on this topic.